Hey everyone, hope you can hear me okay. I'm going to cover lower back pain today and ways you can get out of it. If you have any questions at any point in time, just you can ask me. There's obviously certain things I can't answer because I'm not trying to act as your healthcare provider, but we're going to go over some really good information today. I'm going to attempt to spend about 10 minutes or so doing this, and I'll probably reiterate myself a couple times because people tend to jump in and out of these things. And so on the right-hand side, there's the live chat section. If you're on desktop, that's where you can ask the question if you'd like. Um, and obviously, there is, um, I'm open to any obscure question you guys have, but just be okay that I might not answer the question directly because of what I can and can't say. However, I think there's a lot of misconceptions about what to actually do to get out of lower back pain. And we've been really bad over the last, I think, 10 years as a profession, chiropractic, PTs, just medical in general. Just we've done I think, a poor job of helping people with back pain because back pain has been on the rise. However, it's it's important to note that only the estimation was about only 3% of people with low back pain really ever truly do a structured plan. They just tend to do random stuff. And that's a big danger in it because really recovering from something comes with some structure. And I love YouTube. I love Instagram. I love podcasts. I love all these things, but it kind of feeds people information in a very haphazard format. And so a lot of times people just need a little bit more guidance and structure of what to do step by step and how to improve it. So the at the very end today, I'm gonna just stay through to the entire end. If you miss little parts, you can always catch this on a video too. It should be recorded and up on the channel. If you're not a subscriber, you should be. And at the end, there's going to be an offer of something to get, which I'll just hint at it. I wrote a book. Okay, it's free, and you just pay the shipping is all. But it covers a lot of stuff we're going to talk about today. So let's propose. I want to propose about a 4-step process of how to recover from back pain. Okay. Number one is you have to, I don't want to say necessarily get an exact diagnosis, but you have to figure out what it's not. And a lot of people can figure out generally what it's not, even partially on their own. Um, because a lot of the Dr. Google stuff out there is really not too bad, but it just makes this big laundry list of things that um, people think they have, and it scares people half to death knowing that part of the low back pain might be from cancer or from something else. And the reality of it is, those do happen. There's about 3% of the time, roughly, that happens. Most of the time, it's very easily managed. Not cancer, but back pain managed and reduced, and people get back to normal, I'd say well over 90-95% of the time, without medication, without surgery, without injections. And so they just have to figure out what it is, um, or what it's not. And so, as I mentioned before, that big laundry list of things that people will Google and look up about lower back pain, what their reason for lower back pain, it can name so many things. And why don't I actually just go on to Google? I'm going to Google lower back pain right now and just see what we find. And I'll just give you a couple ideas of things that I guess are not as common, but are probably at the top of Google's list. Dang, it keeps wanting to take me to. Okay, so I'm just going to Google lower back pain diagnosis, and I'm going to first find what pops up. And so the first thing, let's see. This is not so bad. Give me a table or something. Google, come on. So the first thing is a lumbar spine sprain or strain. I'll be honest with you, that's not very common. It says 70% of the time. I don't know who wrote this one, but it's not very common. Most of the time, people do not actually tear or strain anything. The reason why I say that is because if you tore or strained something, you'd have a bruise associated, and we rarely see a bruise. You might see a swelling in the area sometimes, but you don't see any blood discolorations on the skin. So I don't disagree with that. I disagree with that pretty much. The next one is degenerative processes of the disc and facets. I should probably stop on this one. Degeneration is complete BS. Um, I know that I might get some backlash on this, but it's a very old term that people have been using for years, and it was named by I don't know who. It was named by somebody who decided to create a disabling condition. It's like calling your back pain, hey, you're never going to get better because you're just getting older syndrome. I mean, it's very defeating if you kind of think of it that way. Degeneration of spine is not necessarily painful, really, at all. It doesn't have a strong relationship to lower back pain. We see people with degeneration or quote unquote gray hair of the spine very often in our office, and they recover very quickly. But probably a lot of you who are watching this have probably been told that you have degeneration of the spine or arthritis, and it's really not that big of a deal. It's not related to your back pain really at all. I don't know about you specifically, but most people. And when you think of it that way, there's a lot of things that you can do because, again, if your spine is degenerating, quote unquote, how are you going to make that better, right? You might as well give up. And so degeneration of the spine or DDD or arthritis associated with lower back pain, I would not put a lot of weight into that. I would realize that there's a lot of things you can do to improve. Okay. Now, figuring out what it's not, again, is very important to figure out what to do. And I spoke to an MD friend of mine, and I said, hey, do you prescribe something based upon exactly what it is, or do you just figure out what it's not and then you kind of blast it that way? And they say, oh yeah, you don't know exactly what bacteria this is, but you have an idea what it's not. And so you give it like a broad band of antibiotics in that point, in that case. And so um, realizing what it's not, like maybe it's not cancer, it's not an infection, and it's not um, something needs to be surgically repaired is it's very, very useful information because when you take the next step forward, then you just figure out what your spine likes and how to make it support itself. Okay. And as we move forward on to step two, I'll just reiterate myself because a couple new people popped in. We're going to cover the 4 steps of back recovery today. At the very end, there's an offer for the book, which covers a lot of this stuff too. Number 2 is figure out what makes your spine feel better. A lot of you have probably figured this out already. When I lay down, I have no back pain. When I bend forward, it hurts. Or when I go running, it hurts, but not when I walk. Or being seated is okay until I get up. Or twisting is painful, but if I just don't rotate or twist, it's fine. So these are useful because they help give your practitioner information about what your spine likes and doesn't like. And you can help reverse engineer about what you can actually do to make it feel better and the things that they might pull the plug on momentarily to make it so your spine can recover. An example of how this might look is if someone came in, they said every time they bend forward, it hurts their back, but when they bend backwards, it feels okay. I might say, well, are you doing yoga? And they say, yeah, I do forward folds every morning. In that case, don't do that. Well, what should I do? Well, you can do the cobras in there, or you can do back bends or up dogs. Those are all fine because they make the person feel better. Doing something, you don't have to push through pain to feel better in your back. It's kind of a misconception. And I wouldn't necessarily stretch for all types of back pain. Actually, we fairly ever recommend stretching to people, and we have a really good result getting them better. So understanding what your back likes and doesn't like in step 2 is really important because we have to cool things down in order to build them up a lot of times. Think of this like a sunburn. If we gave you every remedy under the sun for a sunburn, but we left you out in the sun every day while we were implementing that type of care for you, then you'd still get burned. And the same thing happens here. We remove the offending movements for a short period of time, and we rebuild those things back in as we go through the rehabilitation process. So we're cooling it down in an effort to giving you things that are more challenging. Step 3 is going to be start a rehabilitation program. Usually starts with stiffness of the spine or spinal stiffness. It's not core strength. It's basically endurance or ability for your spine to keep a position. Okay, spinal stiffness is based upon the work of Stuart Mcgill. It's very, very good when it works, and it's really easy to do with with isometric exercises. Also, something that's really helpful is to shift the load at the low back, which you're probably putting into the low back anyways. You shift it into the hips. And so we're shifting loads so your low back doesn't have to work so much, and so it stops aggravating over and over again. And I think we see a lot of people who have back pain with bending over and picking stuff up. They just use their back a lot, and so we teach them to use their legs or knees, and it feels better. Um, so step three is building that rehabilitation process, and I think we all should probably agree on this, that it doesn't come overnight. First aid and reduction of pain comes overnight, but the idea of building some stiffness and building some hip strength really comes in it comes over time. All right, it's the work that you put in will reap the results. Now, a lot of people who have ongoing pain and they can't find out what works for them, they do need someone to help them out. It's very hard to do on your own, especially if you are not a little bit if you're a little bit more emotional about it. I'll put it that way. And a lot of people are when they have some type of ache and pain. It's hard to see what makes it better and what makes it worse. And I paid someone to help me out with my back. Very good use of your money. And if the person figures it out with you, then you should feel like night and day within 2, 3, 4 weeks. Now, that doesn't make it so it stays away. Okay, it's just we just took you out of the sun. Is all. It doesn't make it so you won't get burned again. Building the stiffness and building some hip strength that we mentioned in step three is where we go from there, and that takes 4 to 6 weeks and is an ongoing process. Like 4 to 6 weeks is where you see the bare minimum change, even from a scientific perspective. So don't expect a big change overnight. You might get sore doing the exercises, but it doesn't mean that there's been a big change. All right, just like working out and trying to build like massive biceps, it doesn't happen overnight, and the same thing happens here. Step four. So I'll regress a little bit. Step one: figure out what your diagnosis is not. Step two is figure out what makes it feel better, or quote unquote first aid. Step three is start a rehabilitation program, aka supportive exercises. And step four is start to encounter load or start doing normal stuff. And this is where people, a lot of times they forget about the step by step, and they say, well, my back pain stopped and I'm going to go lifting weights again. And so they might not have done the supportive stuff. They skipped step three. Step four can also be, playing with your kids, picking up objects out of a trash can. Even stuff as remedial as washing dishes and putting on shoes. This is making your spine encounter loads. And if you've been staying away from them, we've also digressed a little bit. And so a lot of times you have to use your rehabilitation process in your programming similar to like a dojo. Like you're not in a fight yet, but you're prepping for the fight. And so the 30 minutes or an hour long that you spend a few days a week doing your rehabilitation program is basically there to get your spine, get your body, your motor programs, your software and hardware to start working well in unison again. Because corrective exercise is kind of like, which is your step three. Corrective exercise is kind of like, imagine you have an iPhone app and then you have updates, right? So they're patching bugs. And so the corrective exercise is the same thing. It's patching bugs in part of your movement patterns. And so after that, you got to run the thing. You got to encounter load a little bit. It's kind of like once you dial in your carburetor, you drive the car to test it. You drive it. You don't just leave it in the driveway and hopefully it feels good forever. And the body's the same way. You have to encounter load. You have to challenge it a little bit to see what still remains. And some people will kind of see this as a flare up. They're not necessarily flare ups. They're just little hiccup points. As long as you're improving, it's all good. But step four is encountering loads and encountering normal activities. So step one, figure out what your diagnosis is not. We call it a working diagnosis in medical. Step two is first aids, or figure out what makes your spine feel better. Step three is doing a rehabilitation program, which is supportive exercise. And the last one is encountering normal activity or encountering loads. Time to ask question, guys, by the way, because we're going to be finishing up pretty soon. This is the book that I wrote. I wrote it last year. I started to promote it recently. It is a free book. and I map out just what I said earlier on this, okay? There's going to be a link in the description below where you can get it. There's an awesome testimonial on back. There's a lot of people I worked with back pain. It's a free book. I just asked you pay the shipping because I can't afford to send everyone a book, but the books don't cost me that much to make, and I would love for people to have a roadmap through this. So with the roadmap, I call it the map a load framework. Okay. And so the first step is modifying pain, which I mentioned, which is a first aid. You just first aid things. Then we activate the support systems, which I mentioned in step 2. And then patterning, which we didn't go over too much there, but it's kind of an intermediate step. And then there's adding load, which is not really covered in this book. Okay. So consider it, because if you guys don't have a roadmap, it's just you randomly picking YouTube videos, trying random exercises, or you go to one doctor for one visit, and then you go to somebody else for another, and it's just haphazard all over the place. So stay with whatever you decide to do. Whether you worked with me, by the way, we do virtuals or in person. We're good at we help people with spine pain with both, virtual or in person, very easy. Or say you're working with a local physical therapist, or you're working with a chiropractor or a strength coach or whatever. I always think it's fair to give each person 2 weeks to see if they have a change. Okay. If they're picking the right thing and they're helping you out, you'll see some type of change, whether it be 20%, 30%, 100% within a couple weeks, normally, in most cases. I'm not saying everybody, but normally. It won't be perfect, but it's only fair to give that person's rationale and treatment plan and roadmap a fair shot. And I've met a lot of people who have been from one doctor to another, and then I end up being the 15th person they saw. And they come one time, and it's they're going to keep having this problem, in my opinion, because nobody has a handle on them. Nobody's tested to see what's working. It's your body is more complex than but also it can recover. It wants to recover. We just have to figure out the right steps and how to put them into play. But it's really not that complicated. Hey, everybody. Okay, so last call for questions here. I'm gonna leave in 30 seconds if there's no questions at all. So put the questions on the side over there. By the way, you can reiterate. You can get the book in the link description below. I encourage you to get it. It's a good use of your time. It's a really short read. It'll take you about an hour to go through. But in the meantime, if you guys want to see some really good videos on YouTube, and like somebody said, for elbow pain on the side here, I can't mention the things for elbow pain because we're talking about low back pain here today. But we do have a channel, which you can go through the channel and subscribe to it. And at the top, there's a search bar. The search bar says, search me. And so you can search elbow pain for lateral or medial or triceps tendon or whatever you want. And so whatever we have is all there. We have literally over 500 to 600 videos on our YouTube channel, all for free. And we spent a lot of times over this last year really producing as many videos as we can on various different things. So um, I suggest you go through and check out the channel, use the search function, subscribe, because we do have a lot of elbow ones actually coming up in the near future here too. A lot of shoulder blade, a lot of neck, a lot of ankle, a lot of foot, a lot of low back, a lot of knee, hips. We got everything. So thanks for watching the live. And again, as I mentioned before, I'm planning on doing these more frequently. I'll do my very best. I'll do my very best to continue to do these and keep the information fresh. Someone asked, back recap, experience with the Mcgill Big 3. Yeah, I like the Mcgill Big 3. It's as I mentioned earlier in this live. The steps 1 is figure out your working diagnosis is or is not, and step 2 is first aids. Steps 3 is spinal stiffness and hip flexibility. Step 4 is encountering load again. And so a lot of Mcgill's work, it encounters spinal stiffness as well as hip strength, and then encountering load. And so, but also too, there are some people that misinterpret some of the Mcgill work. And if you read some of his white papers from his website, he does this amazing write-up where he talks about how the spine should be able to become solid as an I-beam when you want to, such as a bracing technique, like when you're back squatting, but also too as flexible as you need it to be to dance. And so the dancing alludes to the idea that when we're talking about low back disc, a lot of times low back disc forward bending it just pisses it off. But some people end up thinking I should never bend forward ever again. And so, with that being said, the Mcgill Big 3 is amazing. Dr. Mcgill has some amazing work. But the strategy that we use, at least here, we use part of Mcgill's work. We use part of a lot of work from different people as well. So it all comes down, it's an artistry. And the practitioner you work with, it really comes down to how they can pull in different parts of physical examination, history taking, first aids, positions of comfort, and a bunch of other types of corrective methods. And it's really dependent upon what you show up like. Okay. There is not a standard of exactly what to do every time. It comes down to even McGill will say it's based upon what the person shows up like. But the McGill Big 3 is um, a very foundational set of exercises. So cool. All right. So I hope that was helpful, guys. And we'll see you another day.